Hi there, I'm Catherine, Arcadia Physiotherapy, and I'm going to show you how to do the classic clam exercise, which is to strengthen the side of your hips, your abductors. I'm also going to show you a progression, a side leg raise, and a few tips on how to get that right to really focus on these hip muscles and not getting compensation from your thigh muscles or your bum muscles, which often can take over if the technique isn't quite spot on. So the clam exercise is simply in side lying, and it's a case of raising out the knee to the side, but there's a few things to remember here. So first of all, getting yourself lying on your side so your hip is stacked right over the other hip. So not letting it roll back or forwards. Keeping your heels and your knees in line with each other, and also your heels and your hips in a straight line as well. With your upper body, it's very tempting to kind of be in a position I'm in and sort of look at what your legs are doing. But actually, if you're lying down flat, it's much better for the alignment of your body and to keep everything stable rather than having to compensate in different positions. So all I'm going to do is to keep my feet together, and I'm just going to raise my knee out to the side. And it often helps to just sort of put your fingers on your hip, just outside of your hip bone, and feel those muscles switching on or pressing up against your fingers as you lift that leg. Okay, so the range is actually quite small. It's only about 20 degrees, something like that. Only just slightly wider than your normal hip width, because if you go any further, my hip starts to roll back. If you find that difficult to control, it might be worth doing it against a wall to begin with, feet against the wall, bottom against the wall, so actually you can't roll back, and it kind of gives you a bit of self-feedback as to at what point where your leg is that it starts to roll back. So what we're looking for in the clams is not about endurance in terms of lots and lots of reps as fast as you can, it's about smooth quality of movement. So often when I see patients and they do have weak hip muscles, hip abductors, the quality of this movement is very kind of jerky. It kind of does a bit of this wobble and they can't really control the smoothness of that movement. So, and that will be the case in the early days, but the goal is to make this a nice smooth movement. So instead of doing 20 reps, for example, and you end up kind of rushing towards the end of 18, 19, 20, what I'd like you to do is instead just do slow and controlled, not any particular pace, but nice and steady rather than rushing, and do that for a duration of time, so maybe a minute, or if you can, 2 minutes. Keeping everything steady in hips and just moving this outer leg. You may find there's other parts of your body that are doing the work, so you might find it in your bottom or your hamstrings as that's where it's starting to ache. If that's the case, then you can actually either bend your knees a little bit more, and that might make you feel it's working in your hips, or even if you extend your legs a little bit further away, again that might target the hips for you as an individual differently to somebody else in a sort of more neutral mid-range position. So just play around with it until you're feeling it in your hip at the top here rather than your bottom or your hamstring. It's not unusual to feel a little bit in those areas, but the majority of the work should be doing at the hip. Okay. So expect over the first week or so to progress quite nicely from very jerky movement to a much smoother movement. That's because the brain and the body are starting to make more of a neural connection and control this more steadily. But in terms of real strength, like any gym program, you need to be doing it for sort of 4 to 6 weeks at least, and progressing that on with the activity you're doing it for. So I've got another video which is about strengthening your abductors and standing. That's for sort of further down the line where you're back to running and so on, and needing to make really big strength gains here. The progression from the clam is sort of midpoint, so you still get to lie down during your exercises, which is always a bonus. Keep in exactly this position, everything nicely lined up. Straighten out this top leg. Bring it out so it's level with your hip, and just turn your whole leg down. So not just your toe down, actually feel like you're turning from the hip. You can feel your bony bit on the side there just moving as you turn your leg. Try not to let your pelvis tilt forward, and try not to let your leg drift forward either. And then turning your whole leg round, then doing a side raise. And again, you should feel this working your hips there. So little tips to help with this and get the technique right. Again, we don't want to be up like this because it shortens this whole side of the body. We want to be lying down as much as possible. And it's tempting as well as we lift up this leg to kind of press our side, our left side or the other side, down into the bed. So we want to keep it nice, just a little gap here or just a little room so your waist isn't pushing into the bed or to the floor. Just making sure you keep your spine nice and neutral rather than letting it swing down as you lift up the leg. So keeping it nice and level as much as possible. It's good for your core as well. and making sure, as I say, the leg doesn't drift forward and that the toe doesn't drift back up to point at the ceiling, because then you're just working a different part of your leg. Okay, it's quite common because the leg's actually quite a heavy part of the body. Start getting a bit kind of crampy along here when you first start doing it. And so if that's the case, just come back, return to your clams, which is a bit gentler. Continue with your movements until the cramps settle down, then you can go back out and doing this. And again, keeping the range quite small, doesn't have to be all the way up to the ceiling, because that hurts. And just doing it in small range, and again, trying to work on the quality. You might find when you start this, again, it's a bit wobbly and it's a bit jerky, but again, the quality will build up as time goes by. Okay, so that's the classic clam. Side leg raise, and all to strengthen your hip abductors, which are essential for good core stability during running, and keeping your pelvis level, which helps things like knee pain and back pain and so on. Okay. So I'm Catherine, Arcadia Physiotherapy. Good luck with your hip strengthening.